dapat merenggut sehatmu.
Well, thank you very much for that uplifting video. My name is Ed Davies. I'm the president of the Jakarta Foreign Correspondents Club and a journalist at Reuters. We are very pleased again today to have Professor Wiku Adisasmito, who's spokesman for Indonesia's COVID-19 task force. You've been very generous with your time over the year, Professor, and we've appreciated you giving us regular updates on the pandemic situation in Indonesia, and as we know, that can change very rapidly. So I think it's a good time now to get an update from you on what is happening in Indonesia's fight to contain COVID-19. So with that, I'd like to pass over to you and welcome you to our call today. Thank you.
Okay, thank you, Ed Davis from the President of the GFCC. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon for all of the international journalists. Today, I'd like to present the development of COVID-19 condition in Indonesia. And currently, COVID-19 cases in Indonesia have decreased for 20 consecutive weeks. And the last spike in cases occurred in July 2021, where the highest weekly total cases reached 347,847 cases. And currently, Indonesia's weekly cases are at 1,749 cases, or have dropped 99% from the peak. And this week, recovery rate are at the 2,378 cases, or have reached 96.44% from the total amount of the positive cases. The good news is this relatively high recovery rate is in line with the fatality rate, in which during the last week, Indonesia recorded 59 deaths. Indonesia active cases also continue to decline, where currently there are 7,526 cases, or 0.18%. This percentage is much lower than the world's current active cases of 7.93%. The COVID-19 test will continue to be improved. More than 1.3 million people were screened during the last week, which is an increase from the previous weeks of around 900,000 to 1.2 million people. With this large number of tests, Indonesia positivity rate remains under control at 0.12%. The decrease in positive cases and the positivity rate also reduces the bed occupancy rate, or BOR. And this week, the BOR of isolation rooms at the national level was only 2.77%. And one of the things that we are still keeping an eye on is reproduction rate, or RT, as the numbers have been increasing in recent week. Currently, the RT value in Indonesia is 0.97, which means that it will soon approach 1. Although the cases in Indonesia is currently under control, the government continues to intensify the vaccination program, especially the second dose of vaccines, to provide maximum protections. And currently, the achievement of the dose 1 vaccine is 68.45%, and second dose is 47.59%. Unfortunately, there are still 21 provinces with the second dose vaccination coverage below the national figure, and the effort needs to be made to improve immediately. In this next slide, I will try to discuss more in depth the topic of the Omicron variant. And to date, several regions or countries have confirmed cases of Omicron, such as Italy, Germany, the Netherlands, the UK, Australia, Canada, and also Israel. In fact, currently Japan, Hong Kong, South Korea, Singapore, and Malaysia, which are neighboring countries to Indonesia, have also confirmed the presence of the Omicron variant. Like most countries in the world, Indonesia's neighboring countries have also taken anticipatory steps to prevent this variant from spreading more widely in their country. And these 6 countries have taken several mitigation steps, including Japan closed its border to all foreign citizens and imposed a strict quarantine policy for Japanese nationals who came from countries on the Japanese red list. In addition, close contact tracing of Omicron cases and evaluations of the PCR reagents were also carried out by Japan. Hong Kong imposed a mandatory 21-day centralized quarantine and a 7-day self-quarantine thereafter. Testing must be carried out 6 times during the quarantine period, and on the 26th day testing must be carried out at the community testing center. South Korea imposed a mandatory 10-day quarantine and testing after 14 days of arrival. In addition, South Korea has also temporarily removed some quarantine exceptions, which mean that quarantine procedures are mandatory for all travelers. Singapore enforces mandatory testing upon arrival, and suspects and confirmed cases of Omicron are required to centrally quarantine for 10 days. Australia imposed a 14-day quarantine for its citizens who have just returned from 9 countries in Africa and is reviewing arrival policies for immigrants, workers, and international students. And lastly, Malaysia imposed a mandatory 14-day centralized quarantine regardless of vaccination status and banned self-quarantine. Malaysia also imposed a PCR policy on the 3rd day of arrival and the 10th day of the quarantine. It is important to remember that temporary restrictions of international travelers' entry is not the same as prohibiting the entry of citizens with official citizenship. Temporary restrictions are imposed on international travelers of any nationality who reside or have a history of transit in restricted countries. From the various policies implemented by the various countries in the world, Indonesia also needs to be aware of and anticipate the entry of the Omicron variant. And currently, Indonesia enforces a 10-day international quarantine policy with testing on the 1st day and the 9th day, as well as temporary restrictions on international travelers who live or have a history of stopping in Southern African countries. These restrictions on entry into the country are also continuously monitored. The implementations of strict health protocols will also continue, especially as the country will soon enter the Christmas and New Year period and expected to witness an increase in community activities, which in turn will also increase the potential of transmission. Omicron variant present another challenge in our global fight against COVID-19. As a country who was hit by Delta variant, Indonesia can still recall the struggle it went through and the lives that are lost. Learning from our past lessons, Indonesia believes that there is no solutions apart from working together as global society to prevent another tragedy from taking place. Every government must work in solidarity and collaborate to prevent the spread of the Omicron. COVID-19 is a global pandemic that must also be met with global fights. We must strive for global solutions, acknowledging that in this globalization's era, the safety of our own country is highly dependent on other countries' safety. Next, I will describe the layered COVID-19 control strategies set by the Indonesian government in order to anticipate the potential increase in cases. This potential can be triggered by community activities and the dynamics of the COVID-19 variant. With geographic conditions varying from highlands to lowlands and a population that also varied from only 600,000 inhabitants to 46.7 million people per province, the COVID-19 mitigation strategy established in the country must be adjusted to each region's characteristics. Currently, the central government is coordinating the control of community activities down to the district or city level using regional level guidelines adopted from WHO guidelines. And currently, the Indonesian government, especially ahead of the Christmas and the New Year celebrations, to maintain the decline of the national cases and suppress the upward trends in cases that have begun to occur in several districts and cities. And the government has issued a national COVID-19 control strategy, including the first is the situational domestic mobility restrictions. The government implements an odd-even system in agglomeration areas, provincial capitals, tourist areas, and other areas that are adapted to increasing local mobility. Limiting domestic mobility with strict health screening for long-distance, routine, and logistical travel. In addition, a checkpoint command was established in the respective regions by the implementing agency for the transportation sector, the Civil Service Police Unit, or Satpol PP, together with the military and police force to conduct random testing and monitor mobility on land routes which often escape surveillance. Second, adjustment of the community social activities by regulating operations and tightening health protocols in worship activities, including calling for celebrations or gatherings to be carried out virtually, regulating activities in tourist attractions and in public facilities, as well as controlling Christmas and New Year leave, mudik, and also school holidays. Third, the monitoring community social activities by stipulating the obligation to establish a 3M health protocol task force in public facilities as a requirement to request for operational permits during the Christmas and New Year period. In addition, re-optimizing the COVID-19 task force in each regional administrative area from the provincial to village or kelurahan levels. If it has not been formed, the local government is asked to immediately follow on its formation and make sure to report its monitoring to a centralized system in the National COVID-19 Task Force. In addition to domestic dynamics, the Indonesian government also continues to monitor the dynamics of COVID-19 globally, given the inextricable linkages between countries. For this reason, the Indonesian government also anticipates an increase in cases due to the importation of cases and variants of COVID-19 by first extending the duration of quarantine after arrival at the entrance of the Indonesia to 14 days for Indonesian citizens who during the last 14 days have transited or traveled from a country known to have transmission of cases with the Omicron variant, the new variant of concern type originating from within the country as well as several neighboring countries. For now, the countries listed are South Africa, Botswana, and Hong Kong, as well as Angola, Zambia, Zimbabwe, Malawi, Mozambique, Namibia, Eswatini, and also Lesotho. Meanwhile, Indonesia citizens or foreigners who have transited or traveled from countries other than those previously mentioned have an obligation to quarantine for 10 days. Second, the temporary postponement of the arrival of foreigners except for those who come from countries with a bilateral agreement scheme with Indonesia, diplomatic and service visa holders, ministerial level and above, and they're encouraged on state visits. In addition, kitas or kitab holders, as well as foreign tourists with a history of travel from countries without a case history of the Omicron variant and who can meet other travel requirements in Indonesia are also allowed to enter. In addition, travelers who enter on the basis of a diplomatic agreement who will also be released from quarantine obligations will continue to be monitored with a very strict health protocols, namely the implementations of the bubble system. And it should be noted that screening efforts for other international travelers are still being carried out, such as file screening and general health conditions, as well as retesting. The entry test must be carried out on the day of arrival and the exit test on the 9th day for those who are obliged to quarantine for 10 days. And on the 13th day of those who are obliged to quarantine for 14 days. In addition, in order to prevent the defense guard from collapsing, the government requires specimen from travelers from countries with Omicron community transmission to be sequenced, and sequencing for specimen from other countries will also be intensified. There are two things that I need to lastly emphasize. First, there are three aspects that must be controlled to prevent a spike in cases, namely preventing the importations of cases, especially cases with variant of concern, controlling safe mobility, and enforcing health protocols. And second, nearing the Christmas and the New Year's holiday, the COVID-19 handling policy in Indonesia will be increasingly dynamic, and please pay attention to the development in the upcoming days. Lastly, I will inform some additional updates on national COVID-19 mitigation efforts. The adjustment of domestic community activities toward the Christmas and the New Year period is a part of our COVID-19 mitigation strategy and our effort to prevent mutations due to the high transmission rate. We believe that Indonesia's success in reducing national cases will have a major impact on the development of the cases at the global level. On the other hand, the Saudi Arabian Aviation Authorities updated the rules for international flight entering its territory. And as of December 1st, 2021, flights from Indonesia and 5 other countries are allowed to enter Saudi Arabia directly, and the requirements of vaccine booster was removed. However, visitors who are allowed to enter Saudi Arabia must still comply with the health protocols by undergoing an institutional quarantine for 5 days. In principle, the government of Indonesia will continue to put its best efforts in maintaining good relations with other countries and is deeply concerned of the increase in COVID-19 cases that occurs in various countries, especially due to the outbreaks of the Omicron variants. That being said, that the policy of prohibiting the entry of citizens from countries with cases of the Omicron variants is a part of our joint effort to save humanity globally. The Indonesian government ensures that there are no other considerations apart from this. During these trying times, which unfortunately have taken place for almost 2 years, Indonesia believes that all countries must put more emphasis on the collective effort of assisting each other. We must all ensure that everyone, no matter where they come from, can break free from the COVID-19 pandemic, and hopefully as soon as possible. With this, I end my presentations, and we will continue to the Q&A sessions. Thank you.
Thank you, Professor Wiku. The first question is from at Davis Reuters, Lucy Gado AFP, and Lotta Hedberg C4. How is Indonesia's capacity to detect the Omicron variant and also on the new quarantine rules to prevent the third wave?
Okay, thank you from Reuters, AFP, and also C4. To support the President's directive to anticipate the importations of cases of Omicron variant and the emergence of the third wave, it is necessary to follow up efforts by increasing sequencing capacity and quarantine facilities. A large number of mutations in the spike gene of the Omicron variant can result in undetectable S gene target or S gene target failure, SGTF, for some polymerase chain reaction or PCR testing methods. Therefore, the PCR kit that Indonesia has been using will be adjusted. In the meantime, the adjusted type of PCR kit is already used for all international arrivals. Data from the Ministry of Health shows that the sequencing process is carried out at 6 arrival gates for international travelers, where each lab has the ability to test as many as 500 to 600 samples each day. Meanwhile, regarding quarantine capacity, there are 2 types of quarantine facilities, namely the guest house, the Wisma Atlet Pademangan, and also Wisma Pasar Rumput, with a total capacity of around 3,700 rooms and 70 hotels spread across Indonesia. It is hoped that the existing facilities will continue to maintain its capacity and can accommodate the arrival of the dynamic international travelers. Thank you.
Second question is from Lucy Gadu, AFP. What is the risk linked to the end of the year period for the country? And will Indonesian journalists be prioritized for the third vaccine dose next year?
Thank you, AFP. An increase in cases may occur, but various layers of policies continue to be pursued, both from within and outside the country. The government is very optimistic that it can reduce the rate of transmission on the basis of the strength of cooperation with the community. Regarding the booster vaccines as directed by the President, it will be implemented early next year, especially for priority groups who are vulnerable to infections. Regarding the details of the target will be officially delivered by the government. Thank you.
Last question from Lotta Hedberg, C4. Is the government of Indonesia considering stopping current vaccinated travel lane arrangements?
Thank you, C4. So far, the vaccinated travel lane policy that has been agreed with the state of the Singapore. And under this unilateral agreement, Indonesia citizens are allowed to enter Singapore without quarantine as long as they have been vaccinated for the purpose of traveling for a business visit. And also, even though stipulations has been set, the government continues to monitor the conditions of the case. Hence, the policies may be adjusted from time to time while still taking into account other aspects holistically. Thank you. Probably if at Davis, if there are more other questions, probably we can discuss and answers. Thank you.
So if people would like to post any questions, please just say who you're representing if you're representing someone. Perhaps I can just follow up just on Lucy's question about the end of the year. I thought I saw a report that there were plans to lift restrictions to level 3 in some areas had been cancelled. Is that not the case?
Yes, the government of Indonesia recently has discussed about the level 3 policies that was going to be applied during the Christmas and New Year, but then after the several considerations, it will be adjusted and it will be according to the level of each area as stipulated before, which is level 1, 2, 3, and 4 regarding the level of each district and cities.
Okay, thank you. Seeing if there are any more questions out there. I mean, well, one question I had really was about tourism. I mean, obviously, Omicron has complicated the tourism outlook, I imagine. But at the same time, it seems like Phuket, say, and Thailand has seen an influx of tourists through their sandbox system. But as I understand it, Bali is still not really seeing too many coming in. Can you give us sort of any update on the tourism situation?
Yes. At this moment, the policy regarding tourism still remain the same. We observe the situations greatly because we want to make sure that the tourism during the Christmas and New Year is under control. Therefore, the people mobility and the screening policy, as I mentioned before, will be implemented strictly to make sure that people who are coming for tourism purposes internationally or domestically to Bali, we want to make sure that they are healthy. Thank you.
Okay. Okay, if no more questions, there was still, I mean, in terms of vaccinations, I was looking at your figures and we were almost at the 70% first dose mark, if I'm not, if I'm correct. I think that was a figure that the health minister did talk about when looking at reopening, that was a target I think that the UK had used. So have these figures been adjusted now in light of Omicron risks?
Yes, at this moment, with the coverage of the first dose that almost reaching 70%, and hopefully that will be reached by end of the year. And the evidences that we received from international or other countries, it seems that the vaccinations policy that we have and coverage still protective to the people, and we will continue to monitor the development of the research findings and survey findings from other countries. And of course, we will adjust the policy when the evidence occur.
Okay, thank you. Still don't have any other questions at the moment. Just further on vaccinations, I mean, I was looking, I think your figures show different areas, obviously at different levels. What are the issues in some areas? Is it purely about people are too dispersed to, you know, it's taking much longer to get their first doses, or obviously in Jakarta, you know, has raced ahead, but I'm just wondering what are the obstacles you're seeing in other parts of the archipelago in terms of vaccination?
Yes. There are several challenges to make sure that the coverage of the first and second dose in all regions, districts, and cities to be met with the national targets. But of course, there are obstacles related to the logistical issues and also vaccinators. In some areas, there are limited vaccinators, so that's why we deploy the army and also police to make sure to support the civil government in those areas who are remote and difficult to reach the people. And at the same time, we promote the promotions of vaccinations to make sure that the people understand the importance of the vaccinations, and it seems that it's quite well in terms of the progress at this moment. in terms of the coverage. So that's why we want to make sure that all obstacles can be overcome with the support from pentahelix movement, including police and also army to support the government. Thank you.
And has there been any discussion, I mean, on mandatory vaccinations? And this is something obviously being discussed in Europe and some other countries in terms of trying to ensure that everybody, you know, to try and prevent vaccine hesitancy or just to try and force people to, you know, to become vaccinated. Is that something that you're looking at?
Yes, there are some issues related to that in Indonesia, but we always discuss about any obstacles that happened, and we try to overcome case by case. And we are in close communications with the local government authorities, and the central government always support the local government when they find problems, and we use the data that we have to prove that we should have the same data to work on, and we improve from time to time. Thank you.
Thank you. I mean, in terms of, I don't know how much this crosses over the task force, but in terms of general visas, I wondered whether you sort of look at, you know, I think for quite a while, visas of national importance have been the ones that have been favored, and certain business visas, you know, whereas I think perhaps with journalist visas, we're not at the front of the queue yet. So just a sort of broad question of whether this is something that the task force looks at as to, in terms of priorities for foreigners who are going to be allowed to come in. And obviously with diplomats, they've been allowed to come in all through this period. And if you had a KITAS, I think you were okay if you could roll it over. But in terms of people outside the country, I mean, we haven't had many foreign journalists coming in because of visas haven't been issued. So I just wondered if that's something you're able to comment on.
Can you repeat the last part?
Yeah, I mean, it's really related to visas, particularly for foreign journalists. You know, some people have applied and they've been told that, you know, for now they're not being approved at least until the new year. So I suppose it's just a question of whether this is, you know, a discussion amongst involving the task force where you're looking at priorities of different groups. I mean, I think the last foreign journalist that came in was several months ago, and then obviously the Delta wave interrupted things, and I think we all understand that. But I suppose we're just looking at whether there's a discussion for making the smoothing sort of visas for correspondence again in the new year, or any timing on that.
Yes, I'm not fully aware of that, but I will looking for the status of that. But I think if I will raise that issue for the foreign journalists to come to Indonesia. Thank you.
Thank you very much. Okay, well, I'm not sure we have are people being shy, or do they have any more questions? I mean, I think there was a question that Lotte from C4, her part about the healthcare system. You know, is there anything that you've been discussing in terms of ICUs, I suppose, or other things to be ready in case there is a third wave? And, you know, and I think you do seem to have acted quickly in terms of Omicron. So I just wondered, you know, but obviously it's very difficult in a lot of countries to tell whether this variant might have come in already. So is there any on the health system have anything's been done or a plan to be done?
Yeah. Based on the past experience with the second peak of cases in Indonesia, the healthcare system in Indonesia has been challenged very much, and the capacity has been increased, and even some of the facilities have been improved, and equipments and others are also pharmaceuticals also being mobilized. And I think that experience have improved the capacity of the Indonesian healthcare. Although we understand if we have to face with another peak, of course the healthcare system will not be sufficient to provide services if the number of the cases is so high. However, the system itself has been in place, and the mechanisms, if there is any increase or indication of increase of cases in any area in Indonesia, will be monitored very closely, and we hope that we can overcome before it reaches the peak of each area, rather than collectively nationally. So that therefore, in terms of system, we are ready, but of course, we will not be able to cope if the number of cases beyond the second peak that we experience. We have the backup system with the centralized isolations places all over Indonesia, including in big cities, and those are the backup system that will work when the second peak or the third peak will come. But of course, we will prevent that to happen by monitoring very closely any indication of increased cases in anywhere in Indonesia. Thank you.
Thank you very much. Okay, well, I'm not sure that we've got any more questions at this point. I would like just to give a quick plug that we have the JFCC annual general meeting and end of year gathering on Thursdays, which Minister Sandiaga Uno will be making some comments, and I'm sure he'll touch on tourism as well. And we also have, but it should be a fun event. We have an exciting Indonesian musician, violinist, and also we have some exciting prizes, I've heard. So please do sign up for that
Sure.
since it's only in a couple of days' time. And with that, unless there are any more questions, I'd like to thank Professor Wiku for his time yet again. You've given us regular updates over the year, and I think it's been very helpful to all our members. And you know, I'm hoping that next year we won't be meeting so regularly, perhaps, but.
Yes.
You know, I think as we've learned, this pandemic has many twists and turns, and it's going to be carrying on at least for part of next year. So thank you again for giving us all this time this year.
Okay, thank you very much, Ed Davis and all international journalists who joined with this press conference. We hope that you understand the situations in Indonesia, and let's work together to save the world. Thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you all.